Hi, my name is Rick Olderman. I'm a physical therapist and somatics practitioner, and I want to talk to you about back and sciatic pain. What's going on here? Why is it so difficult to fix back pain and sciatic pain? Why is it so chronic? Let's take a look. It's important to understand that our bodies work as a series of systems, so an injury never really occurs in isolation. That back or sciatic pain that you're having isn't due to usually just one cause. There's a whole systemic breakdown that's happening here. There are several types of problems that fit into this category. One is piriformis syndrome, degenerative disc disease, back pain, bulging discs or herniated discs, facet joint issues, sciatica. All of these are included in this systemic approach. But what I've found is that most of these issues can be broken down into three patterns of problems. And here's what they are. The first is called extension problems. And what that means is that the back is excessively arching, or there's too many forces trying to pull it into more of an arch. The second is the opposite, flexion problems, which is a back that is too flat or too many forces trying to flatten it. The third is sidebending problems, where one side of the pelvis is higher than the other and one side of the rib cage is lower than the other. We're going to go over all three of these. Let's start with extension problems. By far, extension problems, which means that your back is either too arched or there are too many forces pulling it into an arch, by far, this is the most prevalent problem that I see out there. Childbearing can set you up for this. And I break this down into lordotic postures and sway back postures that can create extension problems, and we'll see that in just a second here. So here's an example of a lordotic posture. So you can see here on the left here, this arching is excessive here. And usually the stomach is a little distended and the pelvis is tilted forward. And this is what it looks like in a real person. Excessive arching of the back. And maybe this belly is a little too distended here or large, and then the pelvis is tilted forward. A sway back posture is similar but a little different, in that the pelvis is usually tilted backwards, and it's usually someone who's just kind of sitting back on their back a little bit here, and you can see how that looks a little bit different than a lordotic posture. And usually the whole pelvis and the whole body is swaying forward over the foot at that point. So no matter what posture you have, we have to fix the stressors that are causing it. And so some of this will include postural cueing with shoulders. Locking the knees is a big deal. Tight hip flexors is a big deal, especially with lordotic postures. Poor butt muscle function or poor gluteal function, walking patterns, sitting habits, bending habits. We'll go over some of these, but all of these are addressed in the interactive online clinic here, and all of these are contributing to constant stress to your back. So let's take a look at this, bending over. So here's a normal person bending over, and you can see that the pelvis bends forward and the back rounds a little bit. And so everyone's happy in that case. But what happens with someone with an extension problem is the pelvis is usually bending over a little bit too much, or the back muscles never really let go and allow the spine to round. In fact, this is one of the things with an extension problem. If you bend over and that feels like a really nice stretch at the bottom of this bending over for your back, then you probably have an extension problem. And what most people do is they get in trouble when they're coming back up. And what happens is they extend their back first, and then that triggers the pain. And in sitting, a lot of these people will, especially with a lordotic spine, they will sit very rigidly upright and their back will be arched excessively, which is chronically contracting the back muscles and compressing the vertebrae and nerves exiting the vertebrae. And then the pelvis is usually tilted forward a little bit too much. So let's talk a little bit about flexion problems. Now, flexion problems are very rare. I might just see a few of these a year. You know, I say that tight hamstrings are a contributor to flexion problems, and that is true. But just because you have tight hamstrings doesn't mean that you have a flexion problem, because frankly I see tight hamstrings and extension problems too. It's just not causing a problem in the back. The tight hamstrings in people with flexion problems are part of the problem. And then I find in this population of people that they have poor pelvic control. They don't know how to tilt their pelvis well or move it or anything like that. So I offer a couple exercises on how to gain control of your pelvis and unload the back. And then oftentimes the back muscles are very weak too, and I have some exercises in this clinic on how to strengthen those as well without hurting your back. So with flexion problems, we typically the person will sit with poor posture and the spine will be too flexed, or it'll be flexed excessively at one or two vertebral levels, and the muscles along the back here become excessively weak. So we need to fix that. And then we have to fix flexion stressors such as bending forward. Now what's happening with bending forward, here's our normal again, where the pelvis comes forward and the back rounds a little bit. But in someone with a flexion problem, because typically the hamstrings are too tight and or the pelvis doesn't move well, the back flexes too much or too soon in the bend, and so that's what's causing a lot of pain. Here's what it looks like in a real person. This guy, his pelvis isn't bending forward very much, and so his back has to bend excessively, and you can see that most of that bending is happening right here, and that's where he's having pain. In sitting, what's happening is the pelvis is usually tilted back and the spine is flattened again. Okay, so what we have to do is fix flexion stressors, and that will include changing sitting habits, lengthening the hamstrings, changing how they bend forward, and developing back muscle strength. And then finally we have side bending problems, and these can happen together with an extension problem or a flexion problem. And side bending problems are usually responsible for unilateral pain on one side or the other. For instance, sciatic pain down one side or back pain just on one side of the back or the other. There's usually a component of a side bending problem that's happening here. And I'll show you what that means in just a second. Side bending problems can cause rotation of the spine, and they can cause a lateral tilt and rotation of the pelvis. They're a big contributor to sciatic pain. There are three kinds of side bending problems. And there's a left side bending problem, there's a right side bending problem, and there's a complex side bending problem. So here's an example of a left side bending problem. Here's a woman, if you look at this picture over here, she has a larger crease on this side of her back than she does on this side. And you can see if you look really closely, this side of her hip is higher than this side. So what's happening, and we'll go over to this left picture, is that this side of the pelvis is resting higher, and that this rib cage is resting lower. So we've got a left side bending problem as a result. Now, if it were happening on the right side, then she would have a right side bending problem. And if she has a higher pelvis on one side and a lower rib cage on another, then that's a complex side bending problem. And I usually see that with someone with, for instance, scoliosis. So side bending stressors happen from sitting or walking with poor habits or posture. Or there's an injury to one side of the body, such as an old leg injury or something that causes the pelvis to hike up or the rib cage to drop down. Like I mentioned, scoliosis is a reason for a complex side bending problem. Bending habits, bending asymmetrically from one side or the other can cause that. Asymmetry in work habits or exercise habits can cause that, or unilateral hip weakness. So there's all sorts of things that can cause this, and therefore there's all sorts of ways to fix it, which is great. And you'll be introduced to all of those in this clinic. Here's another reason, just to give you an example. If someone's foot is flattening on one side, well then that causes the knee to rotate in and that side of the pelvis to drop forward, which creates a side bending problem. So here's an example of it over here, where stressors in problems with muscular or joint issues on one side can then feed up to the back and cause a side bending problem. So we have to fix the side bending stressors. We have to correct walking habits, and I show you a way to do that. In fact, the recommendation that I have for fixing your walking habits can actually fix a side bending problem in about 10 or 20 steps. It's really a miracle for a lot of people. We can correct sitting habits, and then we can fix any lower extremity issues in the legs or feet that may be feeding up and feeding that side bending problem. And then, of course, there are other issues that feed back and sciatic pain, and one is the gluteals. And I can't emphasize enough how important the gluteals are to good back function. And they come into play especially when we're walking. If the gluteals aren't working well when we're walking, then our back is going to get into big trouble. And then the shape of our femurs really plays into this, because if we understand how the thigh bone here is rotated, it has a huge impact into how we walk and sit and so forth. And I have solved lots of back pain just by helping someone understand what they should be doing with, because of the rotation of their thigh bones. And you'll figure that out in this program as well. And then there is fascia. Now fascia is just connective tissue. It connects muscles to muscles, muscles to bone. It holds nerves in place, blood vessels, all sorts of things. So it's just connective tissue that's binding and connecting everything together. But there are fascial highways in the body. And so here's an example of a fascial highway that connects the lower leg all the way up to the back, but also into the neck as well. Here it is from the side. So you can see all of this can be dissected from the body as one contiguous piece of tissue. Here's another fascial superhighway. Interestingly, one time I was working with a girl's plantar fasciitis to help her with that. And at the end of the session, not only was her plantar fasciitis fixed, but she also told me that her headache had disappeared. She had had a headache for several days too. And so I believe what we were doing was affecting the whole fascial highway here. Here's another one that involves the rotator muscles. So if you have chronic pain or sciatic pain, I don't want you to think that you're broken. It's likely that you just haven't been looking in the right places. And I truly believe that this program will look in all the places that you've been missing, and you will have the information that you've been looking for so long. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the interactive online clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.